Hello, today we're going to talk about what is pain medicine. It's a very broad and yet very simple question to a very sometimes complicated and difficult answer. In short, pain medicine deals with patients in pain. So the idea is you develop pain, you go to the doctor tells you take aspirin or take Advil or take anti-inflammatory medication, you try that doesn't work, and then after several attempts, you're sent to pain management doctor. In reality, the truth is it's a lot more complicated than that. Pain medicine physicians typically have an underlying sort of field that they've studied prior to going into pain medicine. A lot of times, some of us do physiatry, which is rehabilitation, where we specialize in rehabilitation field. Other doctors that go into pain management are anesthesiologists and they specialize in anesthesia, yet others deal with neurology and psychiatry. And only after dealing with and studying that field for about 4 to 5 years, they then go into pain medicine. The reason why I bring this up is because management of pain can be very different from a doctor to a doctor, and approach to the patient can also be very different. For example, if the patient has low back pain, the patient goes to the primary care physician who sends them to then a pain management. Somebody who has a degree in or underlying specialty in physiatry or rehabilitation is going to look at the patient in a way that, say, physical therapists would. They would do a very thorough physical exam, they would perform diagnostic maneuvers, and then they would decide how to treat that pain from their focus using pain medicine techniques that they've learned in school. An anesthesiologist, on the other hand, may also perform a physical exam, but they would be a little bit more, say, focused on looking at the patient from a standpoint of pharmacological management or coming up with interventional techniques that they would have used in the past. So you see, the treatment algorithm differs from doctor to doctor and also from patient to patient. But the most important thing to understand is, regardless of what the primary specialty of the pain management doctor is, our goal here is to treat a patient from a standpoint of holistic approach. We look at pain as a symptom, but also as a manifestation of a disease or a condition. So if the patient, for instance, comes to the examination room and he has what's called the sciatica, right, pain going down the leg, a lot of times we would assume, all right, this pain is probably coming from the low back disc herniation. But before we go into treatment of this patient, we would like to order diagnostic studies, and that is MRI or an X-ray or other means to help us manage this patient. So we don't just give you medications. We don't just give a patient an injection. We try to be sure to diagnose this patient's condition. Lots of times patients come in after they've been already worked up, as they say, but by other specialties. For instance, a pain management physician may see a patient who had seen a surgeon, and the surgeon performed an operation, and after the fact the patient still say has pain. Well, in that case, the pain management doctor will treat whatever is necessary to advance this patient further in the continuum of improvement. Other times the patient comes in from a physical therapy practice where they've been doing exercises, the shoulder has been hurting, they are improving, but they're kind of hitting a wall or hitting a plateau, if you will, and that's how they send to a pain management doctor to help facilitate the process of healing and improving. In that case, we may offer an interventional procedure such as joint injection. We may offer a nerve block that will allow the patient to move in the better range of motion for the shoulder. So there are multiple ways why and reasons why somebody would see a pain management doctor. I think the important thing to understand is that regardless of what the condition is, regardless of what the situation with the patient is, our goal is not just to correct the symptom, right? Our goal is not just to improve the pain for today. We are trying to move the patients in the continuum where there is a certain short-term and long-term goal. A short-term goal is to improve the pain. A long-term goal is to put the patient in a situation where this pain does not return or where this problem is actually addressed. So a good pain management doctor, I think, or a good pain management clinic will strive to take that patient and put them through a complex treatment or an algorithm where this patient will have a fine goal of getting better. So when we see patients in our clinic and they come in for the first time, we tell them, look, we will do everything possible to help you. We'll offer this treatment, that treatment, etc. But most importantly, we will make sure that we will have a goal and a game and an end plan for your care so that you will get better. If we can help you, we'll find people that will. And that's where, communicating with other doctors and with other, say, physical therapists or specialists in the area is so important. When patients look for pain management doctors, I always advise them to do the research and to make sure that the doctors who they choose are affiliated with major hospitals. They know other providers. They will be able to address their concerns, not just from a standpoint of a symptomatic management, but from a standpoint of holistic approach and actually treating this patient's underlying problem so that that will be resolved hopefully and they can move on with their lives. I'm Dr. Mila Mogilevsky, and I'm a director of Unique Pain Medicine, our pain clinic. If you find this information useful, please share this with your family and friends, and hopefully we'll see you soon in the future video segments.